Our second question is in relation to social distancing. This one also for you, Dr. Bill. We've heard all sorts of conjecture and projections about when social distancing measures would be lifted. And I have to ask, when and how does getting back to work and school happen?
This is a question that the whole country, let alone Colorado and our communities are grappling with right now. And this is actually going to touch some stuff that Katie will be talking about in a subsequent question. But the issue is at what point do the number of new cases of the COVID-19 begin to level off? And that's what we're doing at a community level, trying to ascertain how many people are getting new infections are occurring. And this can be monitored not only by the testing, it can also be monitored by the number of people that are being admitted to the hospital. When we see as a community that number is beginning to level off and not continuing to go up in an exponential way, then we start to consider that we could selectively begin to back off on some of the physical or social distancing things that we've been requiring. What I predict going forward is that as the testing improves, we'll be able to go to more traditional public health behaviors that Katie will talk about in terms of case identification, tracking, et cetera. And what you may see is that some parts of the community, the requirements are relaxed, and other parts we have to continue keeping the restrictions. And you might actually see this ebb and flow. Some people have called it whack-a-mole, but some people have recognized that we may see certain pockets of the community that we have to keep the restrictions on, and other pockets of the community we can relax. I think the same thing is actually going to play out across the country as well.
Okay.
If I can, I would just add, I think testing is going to be a really, really important part of that, which is what Dr. Bill was talking about. But in order for us to even accurately ascertain that we are on a plateau and hopefully actually on the back end of that kind of initial wave, we need to be able to have testing readily available for people. And so that's why there's a lot of conversation going on right now around testing ramping up across the country. And, Colorado is no exception to that. We need testing to ramp up in Colorado in order for us to even really think about relaxing those restrictions.
I have a follow-up question about this piece about testing, because when I hear the word plateau, I don't know if that means that every day the number of new cases stays the same, meaning on Monday we have 20 new cases, on Tuesday we have 20 new cases, or is it that we want to get to a point where it's zero new cases for a number of days? This is where I get confused with the plateauing piece.
Mm-hmm. So I'll take that one for now. Bill, jump in if you've got something. But so part of that is, yes, as soon as you start to see the number of cases not increase, but just kind of stay the same, that's kind of the plateau that we're talking about. So if you think of it as a wave like this, mm-hmm. If the number of cases stays steady, you're kind of at the top of the wave. And so you're sort of at that plateau part. You're not on the upslope, you're here.
Okay.
But what we ideally want to see is them start to decrease. So we want to kind of be on the back end of that wave. But the testing part of that is really important because for right now in Colorado, the testing has been very limited to only people that are very, very sick. And so in order for us to actually establish that we have truly plateaued, we need a lot more testing to be able to be rolled out because we know that there are people out there that are sick that haven't been tested. And so what you're seeing right now is mostly, people that are very, very sick, definitely people that have been admitted to the hospital and or people that are so sick that they got in touch with their primary care physician and they acquired a test somehow. And even if people have been getting in touch with their primary care docs, they don't always qualify for a test. So we do know for a fact that there are people out there that are sick, but they just haven't been tested yet.
Okay.
The additional piece I would add that's been a real conundrum in the medical and healthcare and public health community is that we do not yet know exactly what the number of people who are asymptomatic carriers out there. And that goes to what Katie just said about the need of testing. the preliminary studies that we have, that I've seen anywhere from 17% as high as 25% of people may actually be positive that do not show symptoms.
Okay.
And so this has been part of the problem, not knowing who they are, then it continues to escalate the number of cases, et cetera. So again, the one more test that we probably should just mention here, in case people are wondering about it, is there's been a lot of conversation about an antibody test.
Right.
And an antibody test is a test to see if you have evidence of antibodies that your system has created in response to the virus. Now, the big question about whether that's important or not is that, can we say that having antibodies to this virus infers protection?
Yeah.
And that's still the question that's being studied right now. If that's true, then one way you could approach this is testing people for the presence of those antibodies and begin to relax, back to your other question, begin to relax some of the social distancing requirements for that part of the population.
Okay. Thank you both.